Hello and welcome to this GIS report with Health in Perspective. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist Natasha Letsom. The community is encouraged to know their status and take advantage of free HIV testing for Caribbean Regional HIV Testing Day. The day, which is recognized across the region, will be observed on June 24th. Knowing your status empowers you to protect yourself and your loved ones and enables you access to early treatment and care. To share more about HIV and sexual health and how you can take advantage of free HIV testing opportunities is Chief Nursing Officer and Coordinator for Family Health Services, Ms. Jacinth Hannibal. Welcome to the program, Ms. Hannibal.
Thank you, Natasha.
Now, to get us started, tell us a bit about Caribbean Regional Day and its objectives.
Okay, Caribbean Regional Testing Day is an initiative of the Caribbean Media Broadcast Partners as well as Scotiabank. And this Regional Testing Day came about in 2008. And therefore, we're almost 10 years into the initiative. Caribbean Regional Testing Day seeks to ensure that as many persons within the Caribbean have access to testing and in order to know their status, the HIV status. The aim is to, by the 10th year anniversary, have at least 100,000 tests or 100,000 persons knowing their status within the Caribbean region.
Nice, nice. Now, what is the current situation locally as it relates to HIV and the statistics?
Well, Natasha, we started monitoring at the Ministry of Health about 1985. And since then, we have 126 cases that have been identified to be positive within the territory. 38 of those persons are actively accessing care and treatment. And there are about 56, we estimate that there are about 56 persons that are living with HIV within the territory. We know that there have been about 38 known deaths. And we also acknowledge that there are some persons that access care and treatment outside of the territory, and we would not have those as a part of our statistics. We also know that persons sometimes leave. And so we have several persons who have started treatment with us, for instance, and have left the territory, and some who come into the territory and access care and treatment, at a later stage of their disease. So we have to factor all those numbers when we're looking at our statistics. When we look at the number 127, we might say, oh, it's very small for the territory, but we access that is just what we know. And there's quite a bit of unknown. That is why we're encouraging persons to know your status. And know the status of your partners with whom you're engaging in sex.
Now, based on the statistics, are you seeing anything you can garner in terms of similarities or any trends you're seeing right now?
Well, the global move with HIV and AIDS, they've identified some key populations. And these are men who have sex with men, for instance. Not necessarily the gay community, but we recognize that there are men who have sex with men in that community as well. Out of school youth, women over the age of 50, people who engage in the sex trade, whether it's transactional sex or it's prostitution. So those are some of the drug users, of course. Those are some of the populations that are recognized as key populations and who we try to target when we're looking, to get information out there to those persons. What we found last year, we noticed that there were several of our cases that we had last year, in which we had 7 cases identified. Some of those persons were women over the age of 50. And so we want to acknowledge that, yes, we're in a population where we have a lot of persons getting divorced. And so we want to just caution, mildly those persons to be careful, to know their status, to know the status of their partners, and to engage in healthy sexual activities.
No, you just gave us a lot of food for thought. You just identified a lot of the vulnerable population as it relates to HIV and HIV transmission. Now, what are some of the key messages or maybe some things that you could tell these people who may be in that category that will, help them to minimize their risk to exposure?
A few years ago, the Nurses Association had a billboard. I don't know how many people would have seen it. Had a billboard at Red Cross by the stoplights. And if I remember correctly, it said preventing HIV is as easy as ABC. A, abstinence. B, be faithful to one partner. And C, to condomize. And I think that those messages are still appropriate today. Basically, we know that the abstinence, sometimes persons have difficulty abstaining. And so we acknowledge that, not everybody is going to live up to that standard. However, if you're going to engage in sexual practices, be careful, practice healthy sexual activities, use a condom consistently, and correctly. Because some people will tell you, yes, I use a condom, but when you ask them to demonstrate, their technique is not as correct as it should be. So we encourage persons to use a condom correctly and consistently with each sexual activity.
Really good messages. And I know, we all try to practice that abstinence, especially when we're, targeting, our adolescent population. And what was interesting that you said a little bit earlier with regards to older people contracting the disease, people over 50. Why are you seeing that? What could possibly be the trend there?
Well, we have not really looked to see or investigated to see exactly what happened. But we know that, when persons, especially women, when we get to the menopausal age, then we tend to have some physical problems or some physical changes that we go through. And some of these physical changes would make us, a little bit more susceptible to, viruses passing or having infections. So it's not just about the HIV, but there are other infections as well that a woman going through menopause or past menopause might also be susceptible to.
Okay. And I know in terms of current events, a while back, there was a lot of talk of people out there who may have the disease that, are willfully infecting other people, even here locally. What do you say to what do you say to something like that in terms of the person who may be the perpetrator and, other unsuspecting persons?
Well, there is, it's, what can I say to that person? But I do know that the BVI Criminal Code does make allowances for those cases. So in the case that someone is willingly infecting someone and that can be proven, then there is the judicial processes that can occur. So, it is to me, the onus is on the persons who are engaging in sex. Yes, we acknowledge that there's some criminal activity going on, but for consensual sexual relationships, just to, make sure that those persons are using protection, make sure that you know the status of your partner and that you're not engaging in activities that are going to diminish your ability to make good choices.
Which are?
For instance, we know that alcohol and drug use, marijuana, and so on, and other forms of drug use, these drugs are what we call mind-altering or mood-altering agents. And those drugs, people might say you use alcohol and drugs in the same sentence, but sometimes alcohol also can cause mind-altering reactions. And things that you would not normally do, you would tend to do when you're under the influence of alcohol and some of these drugs. Some of the decisions, the safe decisions that you need to be able to be conscious enough to make, you're not able to make those decisions because of the influence of alcohol and drugs.
Now, what is the importance of knowing your status and how often should we be tested?
Okay. Now, at least once, everybody who is engaging in sexual activity should know their status. Then it depends on your activities whether or not you need to have another test. If someone is engaging in risky sexual behavior, then we expect that person will be tested, at least every year. The standards now is that you have a HIV test whenever you're having your annual pap smears, or whenever you're having your annual physical, whatever those may be for the men, whenever you're having a prostate exam, whenever you're checking your cholesterols or your annual physical, whatever your annual physical is, that you will also have an HIV test. And, back when HIV started, there was a lot of scare about HIV being a death sentence, etc., etc. And a lot of persons were afraid to know their status. But today we have made so many advances in terms of HIV and AIDS care that for persons with HIV, the ability for you to have a very good life could be just as much as taking one tablet a day, simply the way you would take a vitamin tablet or you would take a contraceptive tablet. So, and as well, yes, you must do your other blood tests and so on. But if you have diabetes, you have to take your insulin every day, and you have to do these blood tests as well. So it's a matter of engaging in healthy practices, you know, both with the physical health and the sexual health as well. Yeah. I think that, as I said, we have come such a long way that people should not be afraid anymore of knowing your status. You know, knowing your status empowers you. You know, yes, you might have taken a chance and you've come and you've done your test and it's negative. Okay? Negative doesn't mean that it's all negative. It means that there are no antibodies that we can pick up in your blood at this time. So we ask persons to have another test within 3 months. Once you do that test and then you're negative, then you know that, yes, okay, thank God, you know, but then you know, like the lady in the Bible said, go and do differently, right? So then you know that from this point onwards, there are some steps that you have to take. So it empowers you to make some healthy choices. Right?
No, in terms, what if you get that positive result? Then from your perspective, in terms of what's the next step? Somebody comes there, they have a positive result. Is there any counseling? What happens next for persons who do test positive?
Within the Ministry of Health, there is and the BVI, there is a network of services that are available to persons who have tested positive. A positive test, we always repeat. Once we do a screening test and it comes up positive, we always have to do a lab test to repeat it to make sure that this person is indeed positive. Now, we've adopted a test and treat regimen. So once you're tested on that second test, third test, and you are positive, then automatically we start treatment. Right? Now, there are services within the BVI HSA. There are services within the private sector. We have doctors who will specialize and who can attend to those persons. We also have mental health support, because we know that, you know, there's a lot of scare, as I said before. Persons really need that mental health support to help them to go through the pathway, you know, towards a healthy life. So we have those supports within the health services, and we usually engage the person who have tested positive, engage them in those networks. We also have the BVI AIDS, HIV and AIDS Foundation, and they're doing a remarkable job as well in terms of the social support of these patients. You know, so they have their own networks in terms of their telephones, their WhatsApp, the social media. They talk to each other, they have meetings, and there's a lot of care and support, you know, within that group for persons with HIV.
Nice. Now, as part of your Testing Day initiative, you have a whole host of opportunities for persons to take advantage of free testing. Try to encourage our viewing audience and our listening audience today to take advantage of those opportunities and tell us where they will be.
Okay, we have three major areas or three major activities where free testing is offered. And we're going to be offering free testing from the HIV Foundation office, and that is located on at 33 Porters Road. That's right on, we used to call it Back Street in the day, just before you get to the BVI Beacon, and that's their offices. They'll be offering free testing. At the Family Health Unit, that is upstairs, second floor, Betita Fret building, and that is above Little Switzerland. And we will also be offering free testing, and we're offering testing at the Family Health Unit on the 22nd, the 23rd, and the 24th, and that's free testing as well. We're also partnering with the HSA to provide an outreach in the 42nd Street, the exact location, and we're working on that detail right now. However, we're trying to offer testing towards the evening going into the night on the 24th, and more information regarding that will be submitted to the media. Yeah.
Now, as we wrap up now, Ms. Hannibal, just pull it all together for me. Your key messages, your vulnerable population, and basically a call to urge people to take advantage of those testing opportunities.
Okay, no, the theme that we're using this year in our territory is know your status. The global theme is, are you positive, you are negative. We chose know your status because whether you're positive or you're negative, you need to know. You know, a lot of us sometimes, even as married women, we take a lot for granted. You know, and married men, we take a lot for granted. I don't want to be gender specific, but we each need to know our status. The same way we need to do a pap test, the same way we need to do a prostate examination, the same way we need to get screened for diabetes and hypertension and the like, we need to know our status when it comes on to HIV, because help is there. Help is there. There's no need for you to wait until you develop AIDS or symptoms of AIDS to enter the care and treatment spectrum. Help is there to prevent you from getting to that state. Yeah? And to the persons, the out-of-school youths, you know, wait until you're ready. If you can't make a decision about whether to or not to have sex, then you should not be having sex. If you can't make a decision to say yes or no when it comes on to sexual activity, if you're afraid to say no, then you should not be having sex, right? And for those persons, once you're sexually active, you need to be cognizant that it's not just HIV. There are STDs out there as well. And to be, you know, on the cautious, here on the side of caution, right? So abstinence, and if you can't be abstinent, this is saying that if you can't be good, be careful. If you can't be abstinent, use a condom correctly and consistently every time, right? And know your status and know the status of your partner. Stick to one faithful partner.
Awesome. Thank you very much for coming on the program and sharing that vital information with us.
You're welcome. Thank you very much, Natasha, for having me.
No problem at all. Thank you for tuning in to this GIS report where we spoke about HIV practices that can put you at risk and how you can take advantage of free testing opportunities associated with Caribbean Regional HIV Testing Day, which will take place from June 22nd to the 24th at the following locations. At 42nd Street East End on June 24th from 4 p.m. to 7 p.m., the HIV Foundation offices at number 33 Porter Road on June 23rd and 24th from 9 a.m. to 2 p.m., and at the Family Health Unit located on the second floor of the Betito Fret building from June 22nd through the 24th from 9:30 a.m. to 3:30 p.m. Know your status. Protect yourself. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist Natasha Letsom. Thank you for tuning in.